I'll be presenting about promoting mental health through active participation in programs and activities in home. But before that, I want you to share with you who am I and all that. Don't be deceived about the picture. This is me a year ago before I started being the head nurse of the home. So you'll see the transformation in a year after being the head of the home. It's kind of stressful and all that. I'm actually from Philippines, but I started my nursing career in Singapore. It was a fluke because I was trapped there because of SARS. If you all remember, in 2003, there was this SARS, the severe acute respiratory syndrome. So I was quarantined there and I couldn't go. I was in Singapore for a holiday and I couldn't go back for like a month. So I went through a website and applied as a nurse. So I started my nursing career in Singapore, kicked off in Singapore after graduating from Philippines. And from there, I worked my way up, and now so I've been in Singapore for like, okay, let's not talk about how long I've been there, because probably you'll get to know my age, but I was 7 years in dialysis, 4 years in cardio, and after that, I went into clinical safety and risk management, which we dealt with patient safety, medical legal cases of the hospital and all that. That's after I did my master's. And after that, I told myself I had enough of the stress in the hospital, so I want to go back into nursing practice. So I became the head nurse in one of the psychiatric nursing homes in Singapore. Okay, so now I'm there. And at the same time, in this home, I'm also a trainer in healthcare and home care, and from the Institute of Technical Education in Singapore, ITE, and also accredited workforce skills qualification trainer also of Singapore. So okay, now we go to my topic for today. So what is mental wellness? These are the topics that I'll be discussing today. What is mental wellness? What is mental wellness in psychiatric residents? Brief overview of all the activities and programs that we started in our home and the evaluation of it. So okay, everybody knows that from textbook, right, from World Health Organization, that mental wellness is actually a state of well-being. So with this, and there's also the wellness model, which we actually used to adopt all the programs and activities that we started in the home. A brief description in the home, so you all know what I'm talking about with as I go through my presentations. That we have like 200 residents in our home. 96% of it are diagnosed with schizophrenia, and about 6% is with mental retardation and behavioral problems. So this home is actually, we categorize it in Singapore as category 1 and category 2, meaning there are those who are able to do activities of daily living. We do have a handful of those in wheelchairs, but still they need less assistance. And if they go into those they become bedridden and they become really very sick, then we transfer them to a psychiatric nursing home. So mine is the welfare home for the psychiatric residents. So okay, with that, so now what is mental wellness in psychiatric residents? We actually focus on 3 things only. It's about emotional well-being, like positive attributes. For psychiatric patients or psychiatric residents, it's as simple, positive attributes is as simple as them being cheerful, being cooperative, discipline, and all that. Those simple things, because it's very difficult to really reach into psychiatric patients. Another one is social well-being. By this, we have their social skills, meaning like they're able to actually talk to those people or those residents that are with them with all the activities and programs that they're in. And they're able to communicate to the nurses also on how they enjoyed every activity and every program that we put them through. And lastly is the psychological well-being. This is actually being able to continue their being functional in the home, like they're able to eat by themselves, feed themselves, and then do their activities of daily living, bathing, brushing teeth, and all those kind of things. So we actually reinforce all this because, as you know, it's very difficult to be in a home, in a psychiatric home where everybody's walking. Our facility is actually 4 floors. It's an open concept, but actually it's locked down from outside. So we have a garden inside and everything. But all the residents are freely moving around. So it's really very difficult for us to see where are all the residents. So we have to do, every shift count of the residents. So we'll know that none of them fell somewhere or none of them had an accident or something like that. So now, the overview of the programs for the residents. So actually, we developed 5 major programs. One is weight management. Weight management meaning we have those for the obese resident and for those that are really underweight. So we enroll them in the programs. We actually handpick those residents that are really very big and put them in programs. Like for example, they go for exercise every morning. They go for walks, brisk walking. They go for cycling. They go for calisthenics exercises. And for those underweight and all that, we have dietitians to actually look into all this. So it's actually a rigid kind of program because it's very difficult for us to actually control their food intake. For those that are in the home, we provide actually 3 major meals: breakfast, lunch, and dinner. And we have 2 tea breaks, one in the morning, one in the afternoon, and then they have supper. So they're really well-fed residents. So they're very happy to eat. But then that's the challenge because those that are really big will get more. Because if you stop them from eating, then they will create a hammock and all that. So it's a very tough job for the nurses and the healthcare attendants to actually look into all this with 200 residents in the queue every day on every meals. And the next one is diabetic management. Of course, aside from having psychiatric illnesses, they also have their own medical problems such as diabetes, heart problems. So we also have to look into all this, and it's very rampant in Singapore that of patients having diabetes. So we also go into this detail of how to take care of our residents with diabetes. So they have really a very strict schedule of their medications, and we really do strict follow-up of with their doctors on how to care for them because most of them have insulins also and all that. Next one is physiotherapy. So we have physiotherapy session also in the home, which we put residents because if psychiatric residents, if you don't encourage them, they will just sit the whole day and don't do anything at all. So there's loss of muscle mass, or either they really are very stiff already. So we really encourage them, our physiotherapists, to enroll them in all this. We really go into detail of seeing all the residents, those 200 of them, on a monthly basis to see how they walk and how they do activities of daily living, so that we will know how to put them in proper programs. Then the elder fitness program, like yesterday early morning, there's the people from Taiwan, they have this range of elderly residents. In Singapore also is the same kind of trend. In about 5 years from now, 70% of the people in Singapore are also going into the elderly age, 60 and above, the kind of thing. So in the home, we also have a lot of this, and it's quite difficult because, for me, not all residents I'll be able to talk to because I don't speak Chinese. I do understand, but I can't speak because I've been there for so long. I don't understand, what do you call this? I do understand Bahasa Melayu for our Malay residents because it's almost the same as Tagalog, which is our main language. And then the Tamil, I really don't understand. So it's quite difficult for me to really go and reach out to the residents. So it's really, especially for me, I need to know how they're feeling and all that. And for elderly residents and patients, it's a challenge every day for me to be able to understand what they want, because they really don't talk at all. You just have to see, and just to see the outside, and also just to feel what they feel, that kind of thing, and assume that this is what they want. So we made an elderly fitness program for them. We actually bring them for slow walk. We start on slow walks and then brisk walking, and then eventually we put them in physiotherapy when they are able. So it's like a you know, a cycle kind of thing. And the last is the care program for the sick and weak. Like I said, we do have those residents that are already in wheelchair. So we do have two rooms in the home which are locked down from outside. Internally, they're locked down also because they are all those in wheelchair. We couldn't transfer them to a nursing home because it's not that easy to transfer patients from one home to another. It takes a while to wait, and while waiting for them to be able to accept our residents, we have to care for them. So we put them in a lockdown place also, where we can have monitor them on more close method kind of thing. So these are the care programs for the weak and sick, those really very, very sick ones. So, and as for the activities, as you know that programs, right, these are specific list of people or residents that are enrolled in those programs. But as for the activities, everybody is welcome, and we encourage everybody to actually really attend. So we divided into seven different kinds of program, and under the seven we have different activities that we can push them. So like the exercise, we have the brisk walking, the normal walks in the park, and the calisthenic exercise. As for the brisk walking, we bring our residents outside, those psychiatric residents outside, but those that we know that won't abscond one, won't run one. Because psychiatric, right, once they're out, they run. And then it's our problem now to go look for them, and have to do police report, we have to do this, we have to do that. And by the time we can't even get them in the system anymore. Even though Singapore is very, everywhere is CCTV here, the kind of thing. If they get lost in the system, they hide somewhere. So it takes months before we finally get to see them again. And then going for outings meaning we bring our residents for in those tourist spots in Singapore. So we also bring them there because some of them are inside the home for 10, 15 years, and they never get to see the new things in Singapore, like the Manila Bay Sands, resort world, those are the kind of thing. So everybody have been to Singapore, means you come. So we bring them there, and we let them see the outside world also. Of course, again, considering they are not those abscondee lists, they're not those high risk for absconsion and all that. And the creative, so we have dance club, we have karaoke session, which some of them really like, the sing-along and the board games. Usually these are the older ones, which once those activities are very stationary kind of thing. Then we have arts, the coloring activities, and the music club. So we have this, for the music club, we have this one group of volunteers from outside that comes in at least once a week. They bring all the different kinds of drums, and they encourage our residents to just bang the drums, that kind of thing. It's actually fun, but it's loud. So yeah. So and then another one is therapeutic. So we have our social workers to do counseling session, and case managers also. And then the bonding session also. So it's like the case workers or the social workers or the case managers. They bring their own specific residents outside. They bring them to restaurants, eat with them, so they experience the outside world, that kind of thing. They schedule, but before that, of course, nursing has to clear them if the resident is okay to go out. So it's like a daily routine kind of thing that the nurses has to okay, are you okay, that kind of thing. So every single person that goes out of the home must be cleared by the nurses. So it's really a tough job in our side. And the last one is vocational. So these are helpers in the home. They help in actually cleaning the tables after meals. We don't let them do the mopping and all that. They just do cleaning tables, collecting trays and all that after meals, and throwing trash bags because we don't want them to actually handle like those broomsticks and all that. They start whacking each other. So we give them to a minimum that they can do, and they still feel that, okay, I'm still useful in the society and functional in the society. And with that, we also give them money. So they work, so we give them at the end of every week, they can withdraw money from our financial side. So we have groups of list of residents who are under the helpers in the home, and also the working outside the home one. So there are also a handful of them which we are able to really bring out to the community to be like cleaners also in the makan shop, food stalls, the kind of thing. We actually coordinate with the managers and all that in the food stall and all that for them to be able to work outside. After their work, then they come back to the home. And we try to rehabilitate them, that kind of thing, and teach them, like, they go into modules, like first, if they're able to like do their brushing teeth, that normal thing, the first module. The second module is actually if they're able to do their bed by themselves. The third one is actually if they're able to wash their clothes. And the fourth one is actually if they're able to actually manage their own money. Because when they're in the home, they're given allowance to go out. When they go for work, we give them allowance, and this is what you have to like spend for today. You come back, you tell us where did you spend the money from. So then we eventually like rehabilitate them to learn how to like do budgeting of their own. And then this kind of thing is like we'll go into phases. Eventually, in like a year or two, when they're able to do them, we release them to the community, and we help them find their own housing, and they're able to like survive in the outside world. Hopefully, they don't come back to us. So, evaluation. So we just started this activities and program. Before it was like everywhere. They just it's something like it's not really what do you call this? This program we actually only started it for within a year only when I came in, so that's why I wanted to present because it's actually working for us. So the first 3 months, most of the activities session that the residents are doing is the movie watching, short walks in the park, and karaoke and activities. It's those in-house only, which are high in numbers. In the 6th month, same thing, but now they go for outings and all that. So we're able to bring them outside. So they're okay with it. We try and test, like testing water, that kind of thing. And residents' participation increased by half of the total population of the residents. So it's like more than 100 of them were able to bring out already. And of course, the qualitative feedback is that by verbal comments of the residents, they actually enjoyed being outside and all these activities. I'm sorry that I couldn't show you graphs and all that because our home is actually fully funded by the government. So anything I have to present, I have to clear with them. So all the graphs and all that. But if you're in Singapore, we'll be able to share with you. But since this is an international conference, I'm like funded by all this, but so that I did it in a descriptive manner, kind of thing. And of course, we are now in our 9th month, which is in September. There are residents, all residents participate in all activities. So they're like 92% of the residents have joined it's either the programs and activities. The remaining 8% actually are those really very sick. So that's inclusive of those that are admitted in the hospital, which is still part of our count, of our master list. So those that are inside the home that are really very, very sick and in the wheelchair and all that. And as a conclusion, so now there's a structured and accessible programs and activities for residents promotes mental wellness or well-being. The programs and activities were introduced to encourage and facilitate continued participation of psychiatric residents in the home. So now we're continuing it, and this January we mark our first year of doing all these activities and programs, and then we can do our evaluation and see how we've done and what else are needed to improve more on this. So that's the end, and thank you so much.